Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now we have Acanthameba keratitis. Acanthameba keratitis. Okay. This Acanthameba is actually a protozoa. This Acanthameba occurs mainly due to the soft contact lens wearers who will use the tap water for cleaning the lens. Usage of tap water for cleaning the lens will result in Acanthameba keratitis. Actually, the most common keratitis occurring due to contact lens usage is pseudomonas, but when we use contact lens on cleaning with tap water, then this results in Acanthameba keratitis. In Acanthameba keratitis, the symptoms are more than signs. Here the patient presents with blurred vision and pain are seen, and this blurred vision and pain are severe, and they are disproportionate to the extent of ocular involvement. When compared to the ocular involvement, the blurred pain and the uh, blurred vision and pain are severe, so severe that they are disproportionate to the extent of the ocular involvement. So thus in Acanthameba keratitis, symptoms are more than signs. Why does this occur? This occurs mainly due to the perineural invasion. Here in Acanthameba keratitis, there is first spontaneous multifocal patchy anterior stromal infiltrates will develop. First and foremost, multifocal anterior stromal infiltrates will develop in the cornea, and these infiltrates will gradually enlarge. These anterior stromal infiltrates will gradually enlarge, and finally they coalesce. So they gradually enlarge and then coalesce to form a complete central para sorry, they will gradually enlarge and coalesce to form a complete central paracentral non-suppurative ring will occur. First they become gradually enlarged, and finally they form a complete central and paracentral non-suppurative ring is formed along with the pseudodendrites. Then what is the diagnosis of the patient? The diagnosis of the patient is, we can do a smear examination is done. In the smear examination, we can use a calcofluor white, acridine orange can be used for the smear. Calcofluor white, and we can also use the stain acridine orange can be used for the diagnosis of the acanthamoeba. Then culture medium is also important. Non-nutrient agar with E. coli can be used as a culture medium for Acanthameba keratitis. Then in Acanthameba keratitis, for the treatment of Acanthameba keratitis, we can use two drugs, that is propamide and polyhexamethylene biguanide drops can be used. Propamide with polyhexamethylene biguanide drops can be used for the treatment of Acanthameba keratitis. Other agents which can be used are, we can use chlorhexidine 0.2%, neomycin 0.175%, clotrimazole 1%, and miconazole 1% can also be used for Acanthameba keratitis.
thank you and thank you for watching.